come into an office like this, our philosophy on healthcare is just a little bit different than what would be considered the traditional model. And we really focus a lot in on prevention and maintenance of health rather than trying to deal with consequences as they pop up. It's kind of like playing whack-a-mole, right? You know, these things just keep popping up everywhere, right? So let's try to get to the root of the problem and figure out if we can help from that source. So I'll go through overall health, and we'll talk about the spine and what a healthy spine means and what problems in the spine mean, what kind of conditions you can come up with, and then how to take care of your spine on your own, some simple ergonomic and postural things that you can be doing that can make quite a large impact. And then I'll talk a little bit about what we do in the office here as well in terms of some of the rehabilitation that we do. So when people do need that type of therapy, that you understand what those options look like as well. Okay? So when we look at our healthcare system, we look at the World Health Organization, studied over 190 healthcare systems in the world. We rank #1 in crisis care, which means this is a really great place to have a heart attack, right? I mean, you're going to get very good care, but we rank 37th in overall healthcare. So we don't do a great job of, you know, keeping you from getting to the point of a crisis in the first place. We spend over $2 trillion in healthcare. We rank 34th in life expectancy, 26th in infant mortality. Right. I mean, these numbers are not pretty, right? So just a quick digression. My family immigrated here from Croatia, and I was the only one born in the U.S., and Croatia is a beautiful country. Are you familiar with where it's at? Eastern Europe? Yeah. Okay. So great country, and I've been there, but the healthcare system there is a little subpar, I would say. But they rank 25th in infant mortality. The U.S. ranks behind Croatia in infant mortality. Okay? Something wrong with that, right?
Yeah.
Yeah. It's not for lack of throwing money at the problem. The statistics they think are even under-recorded when it comes to the problems in our healthcare system. And really, I think healthcare is probably a misnomer when it comes to our system, right? I mean, when do most people go see their doctors?
When they're hurting.
When they're sick, when they're hurting, when they've got the problem, right? And very rarely do we go to our doctors to learn how to stay healthy and be healthy, right? Which I think is really something that should be a mindset that we try to change. So #1 killer in this country is heart disease, and I'll get to why I'm going over these morbid facts in just a moment. But this is probably not a surprise, right? When you read the newspaper, I mean, the rising rates of obesity in this country, you know, in children and in adults, and this is one of the #1 diseases that are going to manifest because of that, right? So 1 in 3, right, are going to succumb to heart disease in this country. #2 killer is cancer, right? So very large portion of the population also succumbing to that. The 3rd leading cause of death in this country is medical error. Is that a surprise?
Scary.
Scary, that's a good word. But this is right out of the Journal of the American Medical Association, right? JAMA, one of the most prestigious medical journals in the world. Okay, and what they did is they took evidence from the Centers for Disease Control and took these statistics, and they show that about 250,000 people die every year from medical error. And you look at the list: 106,000 dying from negative effects of drugs, 80,000 from infections contracted in hospitals, unnecessary surgery, medication errors. Right? The list goes on and on. The reason I bring this up is that the 3 leading causes of death in this country actually have a high rate of prevention, right? So, I mean, you know, heart disease, what can you do to prevent heart disease?
Well, you exercise, you eat right, and it's
Bingo.
The basics.
Yeah, exercise and eat right. That cuts your rate of heart disease by a massive amount, right? And then don't smoke.
Don't smoke.
And you're going to be really good. Now, genetics, I mean, you can't do anything about genetics, right?
Yeah.
So cut that one out. You can't do anything about it anyway. So cancer, what can you do to prevent cancer?
I don't know, what can you, well, get checkups. Regular
Okay,
checkups.
that's great, early screening. But also exercise and diet has been shown to reduce the risks of many of the common cancers that we see: prostate, breast, colon, right? Those are all can be controlled, your risk can be controlled by diet and exercise, right? And then of course, medical error, is that something that's preventable?
Oh yeah.
Absolutely. They did a study where they showed if hospital staff just washed their hands between each patient, that the rates of the infections that they get in hospital would go way down. Which the scary part is that they weren't doing that already, right?
Yeah.
So that's my background, is in microbiology, and I used to work at Swedish Hospital, and then I worked for a private firm in Redmond, and worked in a laboratory there for several years. But so I got to see the the front lines when it came to some of that infections contracted in hospital stuff, which is pretty nasty. Okay, so does that make sense?
Yes.
I went over that? Okay. So when we look at chiropractic, your spine is actually no different than any other aspect of your body or your health. Right? Prevention is key. Once we start to have problems accumulate in the spine, it becomes much more difficult and a much larger task to try to deal with the problem, right? It's much easier to prevent a lot of issues in the spine. But the basis of chiropractic is that your body is really a self-healing organism. It knows what to do to heal itself, right? And the nervous system controls all body functions and processes. Right? So just think about it from a very basic point of view. When I first went to chiropractic college, I just thought of it from a very basic point of view. Somebody asked me, "Why are you going to chiropractic? Why are you going to do this? Why do you even care about this field of medicine or whatever you want to call it?" And I thought about it, and I was like, well, because you've got this system in your body that controls and coordinates everything that happens, right? Would that be considered a pretty important system to take care of?
Mm-hmm.
Sure. But what do most people do to take care of that system on a day-to-day basis?
They don't.
Yeah, most people say, huh? Because that question doesn't even register, right? You don't think about it, right? And there's an old saying that if your spine was on your face, you might take better care of it. But I don't even think it needs to be on your face, because once problems happen, then it really gets your attention, right? Because most people become quite debilitated by neck and back problems. So the nervous system controls all body functions and processes. And here's the kicker: the structure of the spine dictates the function of the nervous system, okay? So all this information I'm sharing with you right now has nothing to do with chiropractic. This is spinal science, right? This is information that we know about the spine and how it functions. And chiropractic is just an application of a therapy to try to help that system, right? And when we look at structure of the spine, it plays an integral role in how well the nervous system functions, because if you look at this, I mean, it kind of looks like armor, right? And that's what it does, is it protects the spinal cord and nerve roots. So here's the quick version of Gray's Anatomy, right? You've got the brain sitting up here, which the brain controls everything, right? But it has to communicate with the rest of the body somehow. So it sends a spinal cord down in between these bones, and at each level, that spinal cord branches out and sends these nerve roots out to every aspect of your body. Everything, right? So the bones in here protect those nerves. If the bones start shifting out of their normal alignment because of things like a trauma, so again, a car accident, or because of repetitive habits of poor posture, sitting, whatever the case may be, then that shifting away from normal can create an irritation in those nerves. That irritation then leads to dysfunction. And we use that vague term because dysfunction can be anything from, oh, I've got back pain, to, oh, I can't feel my leg, or my intestinal tract isn't working like it should, or I can't control my bladder. Okay? So when somebody comes into the office, and I had a gentleman earlier today who had a disc herniation, okay, and what that means is the soft material between the bones bulged out and is pushing on his nerve. And this is anatomically correct for the gentleman who was in today, because it was pushing on this nerve and he was feeling it down into his right leg all the way to his foot. He had numbness and tingling, kind of weakness, couldn't put pressure on this leg, and he had severe lower back pain. Now here's the big picture of why we care about the spine. This little nerve root right here sends pain signals from this area. It also controls the tissues in the leg, and another piece of it, okay, actually goes to the organs in this area as well. All right, so now put that in perspective. If I know I'm irritating that nerve because I feel numbness here and I've got pain here, it also means it's negatively affecting how well it's supplying the bowels and the bladder and the pelvic region. So one of the questions I ask them are, okay, do you have radiating pain in your leg? Yes, I do. Do you have numbness and tingling in your feet? Yeah, I do. And you have back pain, sir? Yeah. How about bowel or bladder control problems? He said, not really.
Not really. That was not a definite yes or no.
Exactly. So my point is, when you start messing with the nerves in the spine, it's beyond the ache and pain. That's kind of the tip of the iceberg. There could be all this other stuff that could be negatively influenced by that irritation. Does that make sense?